Hi, my name is Pamela Jean Peña Florida from Sasan Lipa, and for today's video, I will show you how to administer an oxygen to our client. Our goal will be patient will exhibit an oxygen saturation level with an acceptable parameter. Oxygen is a method which oxygen is supplemental at higher percentage than what is available in atmospheric layer. The purpose of this oxygen administration is to relieve dyspnea, to reduce or to prevent hypoxemia and hypoxia, to elevate associate with struggle to breathe. The equipments that we need to use to order or to perform a oxygen administration are oxygen devices. This is to check the oxygen delivered ordered by healthcare provider. We have also the oxygen tubing. This is considered as the extension tubing. Humidifiers if indicated, sterile water for humidifier, oxygen source, oxygen flow meter, and appropriate room sign. The first step is to bring all the necessary equipment to the bedside and over the table. Next is perform hand hygiene and put PPE if indicated. Hi, may I know your name and date of birth?
Anika Faye Arlelo.
Okay, Miss Anika Faye. Today, I will going to administer you through an oxygen mask. Is it okay for you? It is important because it can maintain addictive tissue oxygenation while minimizing cardiopulmonary work, and also deliver oxygen to people who don't get enough oxygen. And lastly, providing it for the people with respiratory disorders. So, shall we start, Miss Anika Faye? Okay. Provide privacy by closing the doors or draw the curtains off. Refuse safety precaution necessary when oxygen in use. Place a non-smoking sign in appropriate area. The next step is attach face mask to oxygen source with humidification if appropriate for the specific mask. Then, start the flow of oxygen at the specific rate of a mass reducer. Be sure to allow a oxygen to fill the bag before proceeding for the next procedure. Position the face mask over the patient's nose and mouth. Adjust the elastic of the mask so it will be that smoothly and comfortable to the patient. And adjust the flow of the flow rate to the prescribed. If the patient records irritation, use gas pads to the electric strap at the pressure point to reduce irritation to ears and scalp. We assess the patient respiratory status, including respiratory rate and lung sounds. Remove the mask and dry the skin every 2 to 3 hours. And oxygen is running continuously. And lastly, do not use powder around the mask. Excuse me, Miss Anika. I will remove the mask. Is it okay? Remove the mask and dry the skin every 2 to 3 hours. Oxygen is running continuously. And lastly, do not use powder around the mask. Excuse me, Miss Anika, I will just remove the face mask. Remove PPE if you use and perform hand hygiene. And last but not the least is to report and record the procedure.